Good afternoon, everyone. If you can all take your seats, please, so we can start. So much time together and so much to discuss, no? Let's start, and I'm really happy to welcome you to the fourth plenary session of the European Public Health Conference 2025. The session is on the political and commercial determinants of health, very important topics to discuss. My name is Costongs, and I'm the director of EuroHealthNet, and I'm really delighted to be the moderator of this session. Let me start with a quote that's in my mind ever since I heard it. Public health is a political ideology. It's a recipe for expanding government control over people's lives. Well, these were the words of a far-right member of the European Parliament, and she mentioned them to me and Professor Mika when we presented EuroHealthNet's report on social inequalities in health in the European Parliament in the Public Health Committee. I think we responded quite well. Definitely Professor Mika did a great job, but it is very concerning. Because this really shows the reality that we are now facing, that even public health, which is evidence-based, which is inclusive, is being reframed as a political ideology and under threat. And this is exactly why we're here today, to discuss these political matters that is very much linked to the work that we are doing. We also live in a very different world in a way than a year ago when we met in Lisbon at the Public Health Conference. Because in Europe, we see that the political landscape has shifted further to the right. The new priorities of the European Commission is competitiveness, simplification, deregulation, and really opening doors and make things easier for industry. The new Commissioner of Health, Commissioner Varhelyi, is really sort of silencing the voice of civil society. And if you look beyond of Europe, the situation is as concerning. We are not even 1 year in the mandate of Trump, and he has done already so much harm to global health and global aid worldwide, and the impacts are devastating. But it's not only about one leader, about one country, it's a broader geopolitical shift that we are seeing, and how, as public health, are we going to respond to this? Because it's not only the geopolitical shift, but also the corporations and industry. We heard the other plenary session, the tech industry that has a lot of power. And how can we achieve planetary health? How can we achieve health equity and a well-being economy if the power shifts are so clearly there? We have invited two experts, leading experts, to help us challenge to see public health through the lens of the commercial determinants of health and through the lens of the political determinants of health. And I'm really delighted to have them here. And after these two PowerPoint and keynote presentations, we will have a very nice panel with experts to further debate the political and commercial determinants of health. So let's dive into the session. I'm really happy to have a great expert. He's not yet on the screen. Is Professor Dr. Sandro Galea. He is Professor of Public Health, and he is from the US. And Sandro is Dean at the School of Public Health at the Washington University in St. Louis. And I hope you are here with us. It's very early now in the States. It's 6 o'clock in the morning. There you are. Great to have you here, and the floor is yours, Sandro.
Thank you. I'm honored to be with you there. I'm sorry I'm not there with you in person. As Caroline mentioned, I am in Washington University in St. Louis, which is in the middle of this country, United States. I was in Boston, in the east coast of this country, for about 10 years before this. And I moved here at the beginning of this year, in part to be able to be part of a different part of this country, which really is like a continent like Europe, as part of this shifting political turmoil that we are living in. I say that by way of background. So let me share my slides. So I just want to talk for 10 minutes about this, which is we are at an inflection point, and how do we understand politics and power? And in particular, my focus is going to be on the commercial determinants of health to imagine a global health future. And Dr. Gilmore, who's going to come after, we'll talk more about political determinants. You heard from Caroline that we are at an inflection point, but I think we talk about that without sometimes being so specific. But just to narrow in on what the inflection point is, the United States has done its fair share of perturbing the status quo, the United States withdrawing from the World Health Organization. And internally in the US, we have had a substantial amount of churn around our science and around anything that affects health. We have had on the left is our essentially chief health officer in the country, our Secretary of Health and Human Services, Robert Kennedy, who has essentially laid off about 20% of staff in our leading health agencies. And on the right, I'm put the slides to show you that the US is part of this global web of entanglement around science and public health. I said I moved to my new city beginning of this year. This is our local newspaper, and this was the very first time, a couple of months after I moved to my new city, when the local newspaper featured public health, my discipline. Public health efforts left reeling. I thought that was a bit inauspicious for someone moving to a new city to take on a job as a dean of a school of public health. But I think it's important in a moment like this to say, how did we get here? What were the causes as to why we are at the moment? Because I think this has implications for what we do. I think there are many, many causes, and we could talk about them in great length. But I do think that the most proximal cause was COVID. COVID gave rise to the full range of spirit animals that have been haunting us in terms of what we do on health. There was enormous impact on people's health worldwide. COVID became, in many countries worldwide, the second or third leading cause of death for a couple of year period, which is quite extraordinary for a disease we had not heard of. And I think it exposed a fragility in the forces that drive our health. Now, COVID was a health problem, but the health problem of COVID intersected with an underlying political problem. And I don't think we can forget that. I'll show you what it is in our country. This is on the y-axis, you have death per 100,000 people, meaning the lower you go, the less the death. And all I want you to see is the red line and the blue line, which are our two major political parties. And what you see is a growing mortality gap between people who are adherents of these parties. That we have had this growing polarization where Republicans are dying more and Democrats are dying less, which has riven everything we do as a country. And I think health has become a common ground around which a lot have rallied around a particular populist government who has come in avowedly determined to change everything, including how we do what we do about health. And I do understand, because I'm originally European myself, I do understand there is a bit of a tendency in Europe, I think, sometimes to think that America is somehow different, or perhaps a little bit more prone to irrationality. But this is also true in Europe. This graph, if you look, just focus on the left, what you see on the left is that if you go from left to right, you go people's report of their health, from very good health to very bad health. And on the y-axis, you have the percent who vote for populist governments. When populations feel they're unhealthy, they are more likely to vote for populist governments, which I think is the same story in Europe as it is in the United States. So I think in a fraught time, the question becomes, is there opportunity? How should we be thinking about health in a fraught time? And I would like to suggest that this would be a really missed opportunity. It would be a real shame if in this moment of churn and turmoil, we do not reimagine what we think about health. Now, there's much I could say about this, but in my brief 10-minute presentation, I want to focus on 2 points. I would argue that this is the time to focus on the key drivers of health globally and to center equity as our foundational value. Let me start with the first one, focus on the drivers of global health. Well, what is shaping health globally? Well, what's shaping health globally is not what I do, what you do as individuals. What is shaping health globally are these large demographic trends. On the left, you have an aging world. What you see is the darker the color, the old age dependency ratio, which you see is particularly in Europe, which was the darkest. You have more older people who are dependent per 100 working age people. On the right, you have global climate change. On the left, you see people living in cities. On the right, you have density of immigration. And what you see in all this is that Europe and the United States, where I live, are the 2 regions which are going to be affected most by all these 4 trends: climate change, migration, urbanization, population aging. These large macro scale forces are what is going to be shaping health in the next 25 years, which means that this is what we should be focusing on when we think about health. And I think this forces us to remember that health ultimately is not driven by healthcare. If you look here at this infographic, you see healthcare at the bottom of this person's graphical person's feet. What really shapes our health is our environments, people's behaviors, people's socioeconomic status, education, job status, family, social support. And that means if we care about improving health to the end of both improving people's health, but to avoid some of this geopolitical turmoil, this is what we need to focus on. Another way of looking at this is to think of this in this way. I like this graph because it stacks the forces that shape health. You start from the left, individual genes, but then you move to our relationships, our living conditions, our neighborhoods, our institutions, our social and economic policies. I say all this by way of framing, because I think it brings us to the main topic of today's panel, which is that among these are political forces and commercial forces. Just to focus on commercial forces for a second, commercial determinants of health are the activities of the private sector that affect the health of populations. It is naive to think that the health of populations is affected only by governments, because in fact, the vast majority of the population works for the private sector, not for the public sector. So how can we ignore the role of the commercial sector in shaping health? Private capital, particularly in high-income countries, has been rising as public capital has been going down. And you see that, you see private capital rising and public capital going down. And just to focus on the US, for example, this is my country where I live. And what you see here is the largest employer in American states. And you see how Walmart, which is essentially it's a large department store, is very large. Well, Walmart is the largest employer in almost half of American states. That's how important commercial forces are in this country. And by the way, they are equally important in your countries. They are equally important in Europe. When you look at the leading causes of death, the burden of disease attributable to these causes of death in the world, you see on the top, you have diet, smoking, obesity, high blood pressure, high glucose. All of these are fundamentally shaped by commercial forces. All the leading causes of death are shaped by actions of private corporations, which means that as we think about what matters for health, not only because it's the right thing to do by the world, right thing to do by the people we serve, but because it is actually the glue that we need to fix in order to fix a teetering world, which is dealing with these very difficult political forces, we have to pay attention to commercial and political forces that drive them. And it's important to recognize that this is simply a graphic showing some of the high interlinkages between many large corporations, how one cannot even think this way and think, well, this is an American problem, or it's a European problem, or it's a Finnish problem. These are global problems because they are deeply intertwined. So point A, in this moment of turmoil in health, we need to think about what the real drivers of health are. And point B, we cannot do that, we should not do that without continuing thinking about equity, making sure there's no one left behind on health. This is global life expectancy in 2023, showing really that there remains about a 30-year gap in life expectancy between high-income countries and low-income countries, which of course is driven by the low assets that large shares of population share, particularly population in sub-Saharan Africa. This is ultimately unsustainable. It is as unsustainable intranationally as it is internationally. When we talk about health equity, which has been a word that's been much bandied about recently as a word with some political, let's call it weight, you have to say, well, what are we talking about? Well, here's a definition of health equity. Health equity is the allocation of resources according to need, so that preventable differences in health outcomes are minimized and access is fair. The important thing about this is that if we are serious about thinking about making sure there are no health left behind, either internationally or intranationally, we cannot not pay attention to the allocation of resources, because resources are what drive access to all those conditions that I talked about a second ago that drive health. This is where it gets difficult, because it is easy to wave the flag and say, we want everybody to come along in line with health. But to say that we need to think about resource allocation is a harder political question, and Professor Gilmore will, in her presentation, talk more about the political determinants of health. How do I know it's difficult? Well, take a look at just this graph. This is over 200 years, and this looks at global income. The red line on top is the richest 10% of the world, controlling about 50-60% of global income. The blue line at the bottom is the poorest 50% of the world, controlling about 10% of global income. And what is remarkable about this graph is that these lines have not changed much for about 200 years, in that the control of the richest part of the world over over more than half of global income hasn't changed in 200 years, which of course entrenches these inequities and creates the kind of instability that we're seeing now. So I want to conclude, and I want to conclude with this. In a moment of turmoil, in a moment when we are realizing that there are a number of forces pushing against our desires to create a healthier world, and in a moment where I think it is appropriate for us to say, how do we rethink, reimagine health, focusing on foundational drivers, keeping equity in mind? It is important to remember that we do this from a platform of strength. Life expectancy has doubled in the past 150 years, which is the sentinel human triumph and sentinel human achievement. This is due to the work of health. And while I talked about health inequity, while I showed you the graph on the right a second ago, the map on the right, I'm now adding a map on the left showing how much improvement we've made on health inequity in the past 40, 50 years. So we haven't come a long way. We are, yes, in a moment of turmoil, but we, I think, have an opportunity to rethink and reimagine how we do what we do to the end of generating better health. I put here a QR code to, this is a blog that I do on a weekly and bi-weekly basis with some reflections about health, and particularly health in a turbulent time. Thank you. Thank you for having me. I look forward to the conversation.
Thanks a lot, Sandro, for your excellent presentation and to setting out a bit the situation in the US. You mentioned the growing polarization, and that's something that we may be facing in the EU as well, and all of the real drivers towards health inequities and the big income inequalities as well. But you also leave your presentation with some measures of hope that we can reimagine and we can act, because we are not powerless indeed. Thanks a lot, and I can really recommend the blog Healthiest Goldfish. It's a really excellent blog to read. Thanks, Sandro. I am now very happy to introduce to you Anna Gilmore. She's Professor of Public Health and Director of the Tobacco Control Research Group and co-director of the Center for the 21st Century Public Health at the University of Bath. Very happy to have you here, Anna, and to hear and to listen from your insights.
Thank you very much for having me. Well done, everybody, for being here in the after-lunch slot. I want to start, as I would encourage you all to start every presentation in order to change norms in this area with a conflict of interest declaration. I have no financial conflicts of interest, and we have a policy in the centre not to accept money from any organisation whose interests do not align with health, with improved health. So as we've heard from Sandro, and this picture from Trump's inauguration illustrates, at least in part, the social, economic, political, and commercial determinants of health are intricately linked. And we could add to that list, really, the geopolitical dimension too. And that poses some questions for us. You know, how can we best understand and address these complex intersecting issues? We need a way into this problem. And as Sandro said, you know, the commercial determinants are really absolutely key here. And so I would argue that this model that we developed of the commercial determinants of health in the Lancet series a couple of years ago really provides a way into this, because we drew very deliberately on existing models of social, political, and economic determinants, and you can see that in the rainbow shape that very much mirrors the dark green and Whitehead model. But we added to that a really more critical examination of the role of the commercial sector, its power, its practices, its influence, and then its exploitation of the issues that it's influenced. So I know you won't be able to read this, and I haven't got time to go through it properly, but what we try and highlight, for example, is that if you go down to the level 5 at the bottom in the rainbow, that they influence our consumption patterns, our earnings, our ability to access healthcare and medicines. The next level up, level 4, our environments in all sorts of diverse ways, our work environments, our natural environments that are becoming increasingly damaged by some commercial actors, information environments with a huge problem with misinformation and disinformation, and of course our built environment in ways that drive consumption. They also, of course, influence policies. Everybody knows that, and we have a particular problem in this area with health-harming industry influence. But what fewer people know is they also influence upstream regulation. So these are the rules on how policies are made. And our evidence shows that many years ago, a whole host of different commercial actors worked together to influence the system of better regulation in Europe. And they did that deliberately to make it harder to pass public health policies. We thought that was bad, but as we've heard from Carolina, the situation now is even worse with a much more active deregulatory agenda. And then at the very top, of course, they've also influenced political and economic systems. I should flag, of course, commercial actors can have positive impacts, but what we're really focusing on today is the negative impacts and the negative impacts those have on health. And what I want to draw attention to is also this system element of the model, because this is really why we're stuck. So let me explain this to you in a bit more detail. If you start at the left with the dark blue circle, over time we've seen a shift from small family-run enterprises to fewer, larger transnational corporations. And they use their power to influence norms. So norms are beliefs, expectations, values, and they assiduously seek to shape these norms in their own interests. For example, they try to convince us that all these problems, obesity, smoking, and so on, are the problems of a few irresponsible individuals. But think about it, over 50% of the world's population is overweight or obese. And look at Mexico, the world with the highest rates of obesity. It's quite clear that the sharp increase in obesity rates there followed the North American Free Trade Agreement and the opening of that market to sugar-sweetened beverages. The population didn't suddenly become irresponsible overnight, and you can't have, 50% of the world all individually, there's not an individual problem quite clearly. They also try and influence this idea that they should be at the policy table, they're part of the solution. But again, the evidence here is that where these corporations have a conflict of interest, multi-stakeholder initiatives don't work, but many governments are still stuck at that point. So they then influence policies, and by influencing policies, they're able to increase their sales and reduce the cost of doing business. And both of those can harm health, for example, by driving down labor standards or selling more products that are harmful. They don't meet the costs of that harm. Those costs are externalized to us and to governments. And that means that by definition, these corporations are making excess profits. And so their profits go up and the system, the winners are on the left. Meanwhile, we have to meet those costs, government have to meet those costs. That reduces the resources that are available for other issues like welfare and healthcare. And of course, that compounds the harm. So then we've got the losers on the right-hand side. Sandro's already showed this graph, and I'm just really trying to use it to illustrate that because of this system problem, we're seeing this shift in wealth and power to the private sector. And many governments now, wealth is negative. And that really has implications for how they deal with these issues. And we've heard through this conference, the lack of funding for public health initiatives. So there's an urgent need to act. What can we do? So again here, and what's our way into this? Again, I would say to you that we can use this model as a way in. I quite often carry this with me when I go to conferences, because when you're trying to think about what can we do, there are so many things we can do. We can intervene almost in any point in this model. And therefore, having a way into thinking about these problems is really important. But let me focus on just a couple of elements today. So firstly, NCDs and health-harming industries. This is obviously a huge issue for public health. The data that we presented in the Lancet paper showed that between 40% and 80% of NCDs globally can be attributed to just 4 commercial products. And yet progress in those areas is going backwards. Luke Allen's data shows that. So what we need to do is we need to stop ignoring the elephant in the room. And that elephant is the overwhelming evidence that health-harming industries all engage in the same practices as the tobacco industry. That in line with that and what we know about the tobacco industry and from their documents is that voluntary approaches do not work. And nor, as I've said, do partnership or multi-stakeholder approaches where there's a conflict of interest. And that ultimately, all of these corporations, there is a conflict between their interests and the public interest. And the implications of that is that we must regulate. Let's get rid of these voluntary approaches. But then how do we help that happen? A key way into this is to recognize that conflict of interest and address it. So many of you will know that in tobacco control, through the Framework Convention on Tobacco Control, we have Article 5.3. And that requires governments to protect their policies from the tobacco industry and protect policy making from the tobacco industry. So we need to sort of get Article 5.3 writ large. But what people tell us in our current project, we've got a project called Local Health Global Profits, is that the term conflict of interest is really inaccessible. We need a far more positive term, good governance. Every government should be aspiring to good governance. And that then needs to apply across the whole of government. Oops. Can you move the slide on for me? But what we've learned from tobacco, I'll keep talking. What we've learned from tobacco is that just doing that is really not enough. So progress in tobacco control has stalled, okay? And that's really because these corporations are like balloons. If you squeeze their profits in one area, they will find a way to make profits in another area. And we've not addressed the power of the tobacco industry. Tobacco companies remain some of the most profitable in the world, and they use that power to keep blocking progress. So we've got to address the system problem that I told you about. So how do we do that? We need to rethink political and economic systems. If we continue to focus on GDP as our primary outcome, we're going to fail. We will keep destroying the planet. We will keep destroying health. We need to really change the shift of our economies to well-being. And that is, it may seem impossible, but it is starting to happen. We also need to rethink our approaches to policy making. I told you that corporations in Brussels, but also elsewhere, have embedded their preferred approach to policy making. And what this does is it privileges powerful actors because it requires a consultation with those actors, and we've shown how they use that consultation to feed in their misleading evidence. But it also, the impact assessment focuses on the impact on business. It's a business impact assessment. So we need to refocus how we evaluate policies. And of course, if our aim is well-being, that helps us refocus our approach to evaluating policies. We've also got to address the material power of these corporations. If they had to internalize their costs, that would really help us get so much further. So we need to do a lot more work here in understanding what are the best approaches to achieving that. And then lastly, we also need to address the other mediators of power. For example, media. You know, evidence shows that over time there's been a shift of the media to favor commercial interests. But also the way that corporations fund science is a huge mediator of that power, which I don't have time to talk about, but is something else we need to address. But doing these things is difficult. So the next question is, how do we get there? I've just got a few suggestions here. I can't cover the whole lot. So for health-harming industries, industry denormalization is key. This was a key part of progress in tobacco control. And not only does it help you progress, there's also really good evidence from tobacco control that it's effective as a public health intervention. It helps reduce smoking rates and also helps sort of erode industry power. We also have power, and we need to remember that. So think of all the public agencies and all the services they procure, all the contracts they make. Imagine if every time a public agency made a contract, it insisted on fair labor practices. It insisted that the organization it was contracting had a limited ratio between chief executive and average worker salary, that it had equal pay across the board. Imagine if it insisted that organization had a clear record of paying its taxes. I mean, 40% of multinational corporation profits made abroad end up in tax havens. So if you start to make these requirements, you would shift norms of all those organizations and corporations that you're contracting with. And you could change your local economy. So that the Preston model is an example. I'll come on to that. Yeah, so there is the Preston model. Oh no, hang on. So the Preston model, and there's an evaluation there, it is a way in which they use this procurement more positively. We also need to develop model good governance, as I showed you at the beginning, not just in conferences, but in our day-to-day work. Start meetings with querying around conflicts of interest. This is the last slide. So we always blame industry, but we've also got to look at ourselves and up our game. I mean, if I go to any more public health conferences that claim the solution is individual behavior change, as happened at this conference 2 years ago on a panel on commercial determinants of health, I will despair. So we can get better. There's a few ideas here. So let's look at teaching and training. Everyone in the public health workforce needs to understand commercial determinants of health, but also acquire the skills that will help us address it: advocacy, strategic communication, governance. We need to look beyond public health. I get requests from MBA programs to do teaching on this. We need future business leaders to understand this. We need to go into schools and get them to understand the problems around corporate power. What about our research? Please, can we move from continuously looking at problems to solutions? Find out the solutions that work and find out how to implement them. We're doing a project on this already. Evaluations need to be multidimensional. I know we all talk about the return on investment. So when we evaluate a public health intervention, let's look at the economic benefits. Let's look at the impacts on labor productivity. We need to collect and promote data on what's important. Imagine if you opened the paper every day, and instead of having the pollen count, you could also have the pollution levels and the estimated number of people that will be admitted to hospital that day because of the air pollution. You would start to see changes. We need to get better at communicating and framing. We need to harness public opinion. And of course, this agenda is incredibly multidisciplinary, multisectoral, and needs to go from global to local. So it may be difficult, but remember the words of Margaret Mead: we can do it. And lastly, if all else fails, we can also always use strategic litigation. Governments have a duty to act in the public interest. And if they don't start acting, maybe we can resort to this. Thank you.
Excellent.
Thank you.
Thanks a lot, Anna, for your excellent presentation and setting out that it is very much a system problem that we need to address, and issues like norms and all the many recommendations that you showed us. So thanks a lot for that for that work. Now it's my pleasure to invite the panelists on stage. First we have Dr. Dóra Gudmundsdóttir. She is the chair of the Wellbeing Economy Forum and she's director of the National Directorate of Public Health in Iceland. And very happy to have Dr. Lindén. He's the former Minister for Health and Social Affairs, and he's now a member of the Finnish Parliament. And very happy to also have here with us Dr. Mika Salminen. He is the Director General of the Finnish Institute for Health and Welfare here in Helsinki. So we have a very Nordic panel here, which I think is very appropriate to have. Let's start with Mika, you first. I was wondering, I mean, you're the Director General of THL, and how with THL do you navigate the political spectrum in Finland? And how do you make sure that you cover, let's say, the needs or the interest of politicians across the spectrum? And very practically, if you, for example, issue a new report or a news release, do you do a political analysis of how it would land?
Well, thank you for the opportunity to be here. And we have a couple of sort of fortunate circumstances. First of all, we have a fairly strong law that governs our sort of ability to, actually we have a requirement of putting forward issues and proposals that would benefit population health and well-being and actually safety also. So that gives us quite a broad mandate to discuss issues that we think should be taken up in the political process. The other advantage is maybe in the Finnish system that we have always coalition governments. So we have a quite broad political spectrum, and that means that we are not in the trap of sort of very polarized, or at least not as polarized society as some countries that have a bipartisan system. What we do is all of the things that you mentioned. We of course produce a lot of data and a lot of research. But also position papers and reports on various sort of more on a practical level. What we have started to do more and more is to also directly talk to the various decision makers. So we have no problem talking to each of the parties. We are actually at the moment in a phase where there's going to be elections, parliamentary elections in a couple of years. So we're in the middle of the cycle itself, and we will invite and have invited already all the parties to have a discussion with us, and we raise then those issues that are in our mandate. So we try to be as fair as possible, talk to everyone, put our position, which is evidence-based, on the table, and then of course in the end, as is the situation in democracy, you know, politicians make their decisions and that's their prerogative. But we are actively involved in the societal discussion actually on a daily basis.
Excellent, good to hear. In Finland, we have a long history, quite a bit of a history on the well-being economy and the economy of well-being, and also in the way it's being picked up by Iceland. And I was wondering, Dóra, could you say a bit more about how the well-being economy concept helps facilitate the political process towards more health and well-being of people, and what your experiences are in Iceland? Mm-hmm.
Yeah, thank you, and thank you for inviting me to participate in this important discussion. I've been working in public health and public health policies in Iceland for over 20 years, and I think I've learned that, and I learned it quite when we were working on the first public health policy around 2008. We were working on the action plan, and it was run by the Minister of Health. But we found out, maybe it shouldn't have been a surprise, but 75% of the actions were outside the health sector. Because ours is so well stated in the Ottawa Charter, health is not created within the health system. It's created where people live, work, love, and play. So we realized that in order to promote health, we need to work with other sectors. And it was challenging to take health to other ministers. And as much as I love the idea of health in all policy and being here, I think in this building with great ideas on health in all policies, going back to Iceland, yes, every minister has to be a health minister. That was not a success. So, and also when we tried to take the public health to the Prime Minister's office, which we did in 2016 with the next public health policy, the Minister of Health said, this is my topic. This is not the Prime Minister's topic. So health is in a silo. It's in the health system. So when we changed and talked about well-being, because well-being is not owned by one sector, not owned by any one minister, and please do not make a minister of well-being. We need well-being be a term that goes through all the sectors. And I haven't found a politician yet who is not interested or doesn't claim that he's not interested in the well-being of the people. So this approach with the well-being economy, I think we can use what we've learned and we're taking all the important lessons that we have learned in public health to the well-being where we are breaking silos. So the well-being economy approach has helped us engage with other sectors, other ministers, and by founding the Wellbeing Economy Forum, we wanted to building bridge between academia, politicians, policymakers, and business leaders because of what we learned. I mean, the business leaders, they do have enormous influence on the public health, on the health behavior. Mm-hmm. So this is why we have seen just how well-being economy approach can be very helpful with our work in public health.
Thanks a lot, Dóra, for sharing that. I would like to, oh, good, some support. I would like to check with you, Aki Lindén. You are a politician. We can't talk about political determinants without having an actual politician on board. So I'm very grateful that you accepted the invitation. And you have been part of two sides. You know, you have been a minister for health, and now you are in the parliament. Would you agree that indeed well-being economy is a way to advocate for health? Is that also in your experience that well-being indeed in Finland has been really taken up as a Northern Star, I would not want to say, but definitely as a common goal?
Thank you. First, I must say that the difference of these two roles is not very large. Of course, the Minister of Health and Social is more acting. It's everyday work. It is leading in managing. So, but it's quite near anyway the work as a MP, Member of Parliament, because the core of these both jobs is the same, and it is legislation and financing. The politicians talk a lot, maybe 90% of all the time we are talking and we have speeches and discussions and so, but the core is these two, legislation and financing. The roles are a little different. But if I look at my background, so I must say that I have now only been about 7 years as a full-time politician. Before that, I worked over 40 years in healthcare as a GP, a manager in primary healthcare, and then as a CEO in large hospital organizations. And if I try to look a little longer period here, what has happened, so my conclusion would be that during the 70s and 80s, we made very strong work for public health in Finland. We had the Primary Healthcare Act 1972, and year 1985 we had a program for health for all to 2000, as in many other countries also. And these were just, I can say, holistic health views both. But then our country, Finland, went to a very bad economic depression in the beginning of the 90s, and then it took about 15 years to recover from that. And during these years, the private sector and the commercial aspects in healthcare became year after year stronger. I can put some numbers. They are mainly inside the healthcare, but it reflects the whole situation. The private healthcare, which is paid out of pocket or the employers are paying it tripled during the last 15 years. And in the public healthcare, the secondary healthcare, the specialized healthcare, the hospital, their turnovers doubled. But the primary healthcare, its budget was the same all these 15 years, and the lack of doctors and nurses were growing there. But there in the Professor Sandro's very good presentation, as your presentation also very good. So there was that very important picture where was the determinants of health. I remember 30% the social determinants, then 10% the physical determinants, then 30% behavior, and 20% of healthcare. Mm-hmm. But when you are in politics, always when you want to talk about health, after 1 minute it goes to talk about health care. Yes. Because it's the waiting list, it's the treatment of cancer, it's the mental health disorders, how we organize the hospitals and things. So what now is the situation in Finland, I see it quite difficult to talk about health as a holistic view, just in that meaning what I saw in the very good slide. So that is the problem, and there is a big difference about what was the situation 30 years ago when we really talked about health and food and housing and traffic. I can mention, for instance, when I get my driver's license 50 years ago, so at that time in Finland, over 1,000 people died in traffic. Now it's 200. Mm-hmm. Still in Sweden, which has a population double to Finland, it's 200. So we are not in a good situation. Mm-hmm. But you can imagine that 1 year more in life expectancy came from that. So these are the big things, and healthcare is that what we talked after 1 hour there in the parliamentary room when I go back on the other side of the street. Yeah. Thank you.
Thanks a lot, Aki. I would like to put on one Slido. Well, we don't use Slido, but another system. Please scan the code here. We would like to to see what you think is the best way to respond to the political or commercial terms of health, and then I'll bring you all back in. So what is the most promising way to convince policymakers to improve public health governance? Is this the denormalization of harmful industry, which was very much what Anna was referring to? Is it better data and evidence on impacts? Is it citizen participation and public opinion? Are the cross-sectoral well-being framework, so well-being as a common goal? Is it media and investigative journalism? Lots of hearts, that's nice. Okay, so it looks like harmful industry denormalization. They are not sitting at the table and so on, is as well as impacting the public opinion is coming up second. Okay, and then let's go to the second question, and then I will ask you to reflect, and Sandro as well, because you are still with us. What is the one thing public health should do better to address political and commercial determinants? Is it to build coalitions and public trust across sectors? To advocate for accountability and transparency mechanisms? Engage strategically with politics and power? invest in communication and narrative framing, or to reframe policy goals around well-being and equity. So here we see engage strategically with politics and power. That's a very important one. I think we need to pick up further. And secondly, popping up is to reframe policy goals around well-being and equity. Very nice. Yeah, you're only allowed to select one answer, but this gives a little bit the priority that we all feel we need to do better in and act. I would like to ask you to respond. I don't know if Sandro is also still with us. Sandro, if you would like to respond in terms of the last one, maybe, about engaging strategically more with politics and power. How are you doing that in the US now you're facing all these drama, if I can summarize it in that?
Well, I'm glad that that's the one that actually got the most votes. I actually do think that that's the priority. I think I might actually look inward first. I think the first priority is that we need to recognize that forces, structural forces of politics, power, commercial determinants are key drivers of health. Once we recognize that, then it becomes, how do we make sure that we engage with those forces in the world around us? So I actually think that that's correct. How are we doing in the US? Well, I think there is quite a vibrant conversation right now in the US around the role of power, the role of politics, the role of commercial forces in shaping health. Just yesterday, I was hosting one of the leading health communicators in the country in a Q&A session, a little bit like this one, where the conversation was all about how does public health take the moment, which feels like a weakness, and to rethink what we do and reorient around the two things I talked about. Number one, making sure that we push the point that health is all about engaging with politics, power, commercial forces, and to do that in a way that nobody's left behind so that health does not become a political wedge. So I actually do think this is the key priority for us.
Thank you, thanks. Would you want, yes, I saw Anna also nodding about the normalization maybe, because that came up as well, as the denormalizing health harmful industry. Would you want to say?
Do you want to talk about that?
No, whatever. Whatever you
I mean, I agree with Sandra. I mean, we have to engage. I think the question is, have we got the skills? Do we need to improve our skills? Because our framing of these issues is really key. Commercial determinants of health is really not a helpful term. It's not what you want to go in and talk about. So we've got to think carefully about how we frame these issues. I think the idea of well-being, everyone, wants to improve their well-being. And as Sandra said, people are really worried about their health. It is a key issue. Look at all the people that are buying Monjaro and so on. They want their health to improve. And actually, if we harnessed public opinion and improved our framing, I think we could get much better at this communication. And I think it's also about working collectively, as I was saying, because I think academics are often not very good at getting into those spaces, and advocates are much better. But I think also sometimes we just have to be braver. Sometimes it's quite scary to go to those places for some of us. And so I think sometimes it's just being braver.
Yeah, good point. Aki first, and then Mika, yeah.
Yesterday I was in a jury here. We were listening 5 young researchers who had an elevation pitch of their research work, and then we were commenting it. And now, if I realize the situation in other way, so what I should say in my elevation pitch in the psychological and political climate which we have now in Finland, it is that because the lack of economic growth is the thing where all are talking in Finland of that left and right are talking, but how can you have economic growth if you don't have healthy people? So the people, of course, for me, the equality and inequality, they are the most biggest things, but to talk so that all the political parties can agree or really do something is talking about health of people and how it relates the economic growth and our well-being in a whole society. That is the point which we now must do in politics at least.
Yes, yes, very good, very great framing. I think we can learn from and we should use. Mika.
Yes, thank you. I think it's. I also think that engagement with those in a decision-making power or in power itself is actually absolutely necessary. If we just talk to the enlightened like here, we easily agree on things. We put health high on the agenda as a value. We put well-being high on the agenda as a value. That's not necessarily the case when you talk with people in general. Yes, on a sort of deep level, I'm sure, but in the daily life, it's not necessarily true. They may consider, easy access to a variety of different kind of products as something more important. We see that in our discussion quite frequently. That, for example, at the moment. The current government wants to ease the access to alcohol. And the industry and especially our sort of retail industry, the food chains, we have a couple of big food chains, have been very keen on influencing the discussion in a way which frames it as, isn't it convenient? Then if you come with just the health arguments, you easily lose that discussion. So you have to go with other arguments too, which are more conducive to the issue. For example, we bring up the issue that currently our health system is very much under strain. Is it very smart to increase the access to alcohol, which we know creates social problems, creates health problems, creates problems in the family? Right now, maybe we should wait, maybe we should be wiser. So far, we haven't been super successful with this, but at least a bit delayed. Mm-hmm. What we're doing internally is sort of changing our approach. We used to do a lot of communication, short sort of almost daily press releases. It works, they are picked up, but next day there's just another story. Mm-hmm. So what we are trying to do now is to do a much more longer term approach where we select a couple of topics which we really want to influence, and then we use all our tools to address the issue, of course in media, but also bringing together the politicians and our experts, mm-hmm. and discussing what the actual cause and effects are. Yeah. And you cannot forget also the cost part. You have to be able to show also to Minister of Finance that, if you do this, yeah, maybe we get more taxation, but then you have to put more money on the healthcare instead. So is it smart? Yeah.
Excellent. I think we as public health are great in describing the problem. We are doing pretty good in describing what policy recommendations we can give, but we really need to do this analysis of the politics, of the power mapping, to go beyond policy recommendations and engage in that process in order to make sure that our messages and our work lands in the right way. We have 2 minutes. I can make it 3, but my phone says 1. So I want to give Dóra the floor, and then only a few words for the rest of you. Yeah, Dóra first.
I just want to put it quick. I think we need a more humanized approach, more solution, less problems. And we're all humans, and what we have to focus more on the things that we share. We all want to be seen and valued. All parents want the best for the kids. So I think we need to get more into that direction. And leaving no one behind, that there are some approaches that we are doing. For example, in gender equality, where boys are left behind, and that is having a consequences. And I think in public health, we do have a lot to share also with others. There are interventions that are made in good intention, but they do harm somebody, and we need to find more about how we promote well-being. Think about what kind of society do we want to live in, and how do we create that? What we measure gets done. So we need to measure the things that we all do share that are important, because there are so much more things that we do have in common than divides us. And all this polarization, it's really harming our health and well-being. It's not we and the others. We need to find the things that, the common grounds, because we all want to be seen and cared for. And those who are cared for, they will care for others. Yes. So I think that's really our big challenge, facing those big challenges. Yes. And we can do it together.
Yeah, very nice. Thank you. I see you. Yeah, please, very short.
I'm going to pick up on the denormalization, because in tobacco, that was really key, denormalizing the industry. And I know initially that came from the documents that were released through litigation. But actually we have, as part of point 5.3, there is a requirement really for governments to monitor. They don't often do the monitoring, which is probably best because it requires us also looking at governments. But we do actively monitor the tobacco industry, both within tobacco control generally, but my team also does that. And there's a few lessons that we've learned. Firstly, it has to be long-term. We have to do that continuously because the industry is always trying to renormalize itself. And you have to make your findings public. So we run a website called tobaccotactics.org where all the findings are public. And that means that when someone knocks on a politician's door, they can look at that person to see if they're fronting for the tobacco industry. And we also work really closely, for example, with investigative journalists and with advocates, so that when we've got some findings that need action, we can hand those on and the advocates can take action. And it does work. Okay, so, and I'm happy to talk more about that afterwards. But finally, there's something really important that I forgot to say, and that is we have launched today a new website called addressingcdoh.info. And what it's trying to do is bring the Lancet model and just explain how you can use that to think about solutions to the commercial determinants of health in the way that I said. So it's addressingcdoh.info.
Excellent, great, thanks for that. Aki, a very few words, and then Mika, and then we have to close. So just very, very brief.
If I say very few words, it would be health in all policies. It's not a new thing, but we must strengthen that.
Very good, yeah. Mika?
Yeah, I mean, solutions, that's what we need to present. So for example, we are proposing that, for the next government to consider making a health-based taxation on food. We can do it. It's easy, actually. We have all the information on which foods are bad for you. The calorie content, the sugar content, the trans fats. It would be easy to build a model which would favor vegetables, fruit, and penalize those that have all the bad content. So why not do it?
Excellent. We can do it. We have the power. And thanks a lot for our great panelists. Sandro. Thank you. Yes. Yeah. Hi, Sandro. Yeah, thank you. Thanks, huh? Yes.